Why do people from ethnic minority communities continue to have poorer access, experiences and outcomes in mental health care despite 40 years of evidence highlighting inequalities? If we have all the evidence, why does nothing change? Researchers from the University of Bristol, Glasgow and Keele reviewed all the published and unpublished evidence on experiences of communities, service users and mental health professionals. Here's what was found. People from ethnic minority communities are already at higher risk of mental ill health due to experiences of social, economic and racial oppression. These experiences disempower individuals and do not allow space for vulnerability. When individuals experience mental ill health, they do not feel like the current model of care can help them. Services are perceived to be unhelpful. Communities do not feel like it's worth taking the risk to access a service where they are not seen as a whole person and where they fear they may be harmed by Eurocentric, racist, and biomedical approaches to care and treatment. Stigmatizing diagnoses threaten the identities of individuals, families, and communities. As a result, they enter the service as a last resort. The system itself is seen to be based on a rocky biomedical Eurocentric foundation that locates mental illness in the individual rather than in the conditions that individuals find themselves in, and is unable to provide person-centred care to ethnically diverse communities. Everyone in the mental health ecosystem, including carers, service users, psychiatrists, nurses and therapists, find themselves battling against this system to receive or provide appropriate care. Service users experience poor listening, disempowering clinical encounters, re-traumatization, violence, inequitable treatment, and over-reliance on medication. Services are experienced as a form of epistemic injustice and violence. Epistemic injustice is injustice related to knowledge. It includes silencing of voices, misrepresenting or undervaluing individuals' experience or contribution, and unfair authority and distrust. These experiences exacerbate feelings of distress in patients. Services are described as Eurocentric and old-fashioned, and seen to perpetuate racial injustice through the pathologisation of cultural behaviours. Professionals, including psychiatrists, feel inhibited in a system where it does not feel safe or acceptable to talk about religion or spirituality with their patients without being judged by their colleagues. And they feel silenced when they witness racism in diagnostic and treatment decision-making. Service users, carers, and mental health professionals feel that a radical change is needed. Service users value non-judgmental understanding and culturally capable practitioners, talking therapy and trauma-informed therapy. There is a need for a new model of care that better reflects the needs of ethnically diverse patients. This requires statutory services to share their power and acknowledge the lived experience and expertise of service users and the third sector. These organisations provide safe, non-stigmatising spaces for expression of emotional distress and are more responsive to oppressive causes of illness. This includes taking a holistic and empowering approach to assessment, care, treatment and recovery. So, what's next? For more information about the study, including recommendations, visit the link below.